lower right abdomen, we see the appendix, which is inferior to the cecum. It contains a mass of lymphoid tissue, and new research suggests that the appendix contains a good bacteria that can help replenish the large intestine after diarrhea. A missing appendix may be associated with an increased risk for inflammatory diseases. This relates to OT because you need to be careful with the placement of the gait belt. Here we have the esophagus, which is inferior to the pharynx. It enters the superior mediastinum between the trachea and the vertebral column. The function is to convey food from the pharynx to the stomach. It relates to OT because difficulty in swallowing can impact lifestyle as it affects eating and drinking properly. Inferior to the liver, we see the gallbladder. It helps with holding bile and helps with digestion. It relates to OT because it can impact digestion, which can overall change daily life activities. Posterior to the sternum, we have the heart. It is located in the middle mediastinum. The function is to propel blood to all parts of the body. It relates to OT because it can dictate the patient's exertion. Located on the posterior abdominal wall at the T12 and T13 level, we have the kidneys. They remove excess water, salts, and wastes of protein metabolism from the blood while returning nutrients and chemicals to the blood. This relates to OT because it can affect one's blood pressure, which may influence the therapist's plan of care. Also, dialysis is a major component with the kidneys, which can affect OT care. Now we will take a look at the large intestine. Superior to the appendix, we have the cecum. And here is the ascending colon, which is inferior to the cecum, and it is on the lateral side of the small intestines. Now we have the transverse colon, which is superior to the small intestine. Now we have the descending colon, which is to the left of the small intestine. Now here is the sigmoid colon, which is inferior to the small intestine and the descending colon. The large intestine is where water is absorbed from the indigestible residues of the liquid chyme, converting it into semi-solid stool or feces that is stored temporarily and allowed to accumulate until defecation occurs. So, it relates to OT because OTs can help with the treatment of neurogenic bowel dysfunction. OTs can work with toileting and transfers and different techniques with the goal of providing independence with toileting. Here we have the liver, which is located in the right upper quadrant. Except for fat, all nutrients absorbed from the gastrointestinal tract are initially conveyed to the liver by the portovenous system. It stores glycogen and secretes bile, removes waste and foreign substances. OTs are well placed to address many of the symptoms associated with chronic liver disease. The lungs are located in the thoracic cavity laterally to the mediastinum. They are vital organs of respiration. The main function is to oxygenate blood by bringing inspired air into close relation with the venous blood in the pulmonary capillaries. OT can help people living with lung cancer by helping them achieve their goals while managing the side effects of treatment. They also help them to actively participate in activities that are meaningful to them. Here we have the pancreas, which is posterior to the stomach. between the duodenum on the right and the spleen on the left. During digestion, pancreas make pancreatic juices called enzymes that break down sugars, fats, and starches. OTs can provide advice to help people who have pancreatic cancer on how to change tasks and stay independent. Next, we have the small intestine that lies medially to the large intestine and anterior to the vertebral column. This is the duodenum, the jejunum, and the ileum. The small intestine is the primary site for absorption of nutrients from ingested materials. OTs can help people with diseases of the small intestine and helps people stay independent and helps them to reach goals that are meaningful to them. Now we have the spleen that is located in the superlateral part of the left upper quadrant where it enjoys the protection of the inferior thoracic cage. As the largest part of the lymphatic organs, it participates in the body's defense system as a site of lymphocyte proliferation and immune surveillance and response. OTs can help people recover from a ruptured spleen, splenectomy, and other diseases associated with the spleen by helping them carry out their activities of daily living until they are independent. Lastly, we have the stomach, which is located between the esophagus and the small intestine, posterior to many organs. It helps accumulate food and it chemically and mechanically prepares it for digestion and passage into the duodenum. OTs can help people with gastrointestinal disease and can help with difficulty swallowing and eating food.